Hi, I am Valerie Chula. Today I want to present about obesity. Definition of obesity is a medical condition in which excess body fat accumulates to the extent that it may have a negative effect on health, leading to reduced life expectancy and increased health problems. Obesity is associated with higher risk for serious diseases such as type diabetes, heart disease, and cancer. Obesity versus overweight. Overweight is fat, fluid, muscle mass, bone, tumors. Obesity is fat. How is obesity classified? This is the timetable of BMI and class. 18.5 or under is underweight. 18.5 to 25.0 normal weight. 25.0 to 30.0 overweight. 30.0 to 35.0 class 1 obesity. 35.0 to 40.0 is class 2 obesity. 40.0 or over class 3 obesity. This is the following class are used for adults who are least. Which is childhood obesity? Childhood obesity is 5% underweight, 5% to 85% normal weight, 85% to 95% overweight, 95% or over obesity for childhood. Measure of obesity: BMI, body mass index, waist hip ratio, skin fold thickness, air displacement plethysmography, total body electrical conductivity. Type of obesity. 1. Inactivity obesity. It is no secret that a lack physical activity can cause you to become overweight. In this type of obesity, one strong part of the body quickly gain fat and become unhealthy. 2. Food obesity. If you overheat and particularly if you over-incur in unhealthy food, you may suffer from food obesity. Excessive sugar intake can also cause food obesity, which may lead to accumulation of fat around the middle part of the body. 3. Anxiety obesity. Anxiety or depression can often lead overeating and accumulation of fat in the body, since the body must constantly survive in fight or flight mode. To treat this type of obesity, you must control your anxiety. Common treatment include medication or a decrease in caffeine intake. For venous obesity. Obesity is venous circulation is one obesity can cause that genetic in nature rather than habitual in nature. If anyone in your family suffer from venous circulation, you run the risk of the same condition. This type of obesity is particularly common in pregnancy. Exercise is the best solution for this problem. 5. Gluten obesity. You are likely no stranger to many healthy problems that gluten can cause. In fact, gluten can actually cause obesity. This type of weight gain is most common in women. It is often spotted during periods of hormonal change, like puberty, pregnancy, and menopause. Last, exogenic obesity. People whose fat tends to accumulate in the stomach are often suffer from chronic obesity. This is a particularly dangerous condition since it can affect your other organs and lead to breathing problems. It is extremely important to avoid drinking alcohol if you have atherogenic obesity. Several factors are responsible for obesity: behavioral and lifestyle factors, disease, mental illness, genetic. Behavioral and lifestyle factor is unhealthy dietary pattern, less physical inactivity, medication use, easy availability of fast food, unfavorable physical activity environment, less education and skill, food marketing and promoting. Disease. Many diseases like polycystic ovary syndrome, thyroid and other endocrine disorder. Mental illness, depression and eating disorder. Genetic. A person is more likely to develop obesity if one or both parents are obese. Genetic also affect hormones involved in fat regulation. For example, one genetic cause of obesity is leptin deficiency. Health consequence of obesity. According to CDC, obesity affect almost all organ system and create adverse health effect. Hypertension, dyslipidemia, type 2 diabetes, coronary heart disease, stroke, chronic pain, mental illness, low quality of life. This is the pyramid of the physical activity. Thank you. That's all from me.